In this video, I will show you the anatomy of our muscles, and based on that, I will explain how you should train each of these muscle groups. So we're gonna get a bit nerdy, and by the end of the video, you will have a complete understanding of biomechanics and you will know exactly what you should be doing in the gym. To get started, it's important that you first understand the most basic movement terms. That's because our bodies have multiple joints that move in unique ways. We need unique terms to describe a specific movement. All of these movements are in reference to the anatomic position. That's the position where you're standing upright with your feet pointing forward, your arms by your side with your palms facing forward and your head looking straight ahead. This is always going to be your starting position in anatomy. Abduction is the movement of the joint away from the midline of the body, while adduction is the movement towards it. So the most relevant example is going to be hip abductions and hip adductions when training your legs. Next movements are flexion and extension. Flexion is when you're bending or decreasing the angle of the joint. Extension, on the other hand, is when you're straightening or increasing the angle of the joint. So for example, when you're doing biceps curls, you're flexing the elbow. When you're doing skull crushers, you're extending the elbow. We're moving on to the internal and external rotation. So for example, if you rotate your feet towards the midline of your body, that's internal rotation. If you rotate it outside, that's external rotation. Then we also have something called circumduction, which is a circular motion. For example, when you're training your abs with around the world leg raises. So those are the most basic ones. But like I said, it gets a bit more specific than that because unique joints move in their own unique ways. Let's start with the forearm rotation, which is totally separate from shoulder rotation. Here you have supination and pronation. Supination is rotation of your hand up so that your palm is facing towards the ceiling, and pronation is the opposite, with your palm facing towards the ground. So when you're doing regular pull-ups, you're using the pronated grip. When you're doing chin-ups, you're using supinated grip. When it comes to the ankle joint, you have dorsiflexion and plantar flexion. Dorsiflexion is pulling your ankle up towards the body, and plantar flexion is pushing it away from it. So for example, the main way to contract your calves is through plantar flexion. On the other hand, you can contract your tibialis through dorsiflexion. Final joint I want to address is the scapula. We have scapular elevation and depression. So for example, when you're doing shrugs, you're training your traps through the scapular elevation. Or let's say you're applying resistance through the scapular depression, then many muscles would be involved in that movement like pecs, lats and serratus anterior. When it comes to the scapula, we also have protraction and retraction. So for example, when you train your chest, you know that I always tell you to retract your scapula, or when you're training your back, I tell you to protract your scapula at the bottom of the movement in order to fully stretch your back muscles. Now that you understand the basic movement terminology, it's time to talk about the muscles and how each of these muscles are specifically used to create these movement patterns. Then you just have to apply resistance and boom, you have learned how to train each of these muscles. There's 650 skeletal muscles in the human body. We're only going to cover the ones that are relevant when it comes to building the aesthetic physique. Every skeletal muscle needs to have an origin and insertion. It needs to be attached to the bone in order to move it. Based on that, we can determine what is the function of the specific muscle and which movement we need to load in order to effectively train it. We're going to start from the neck and then we'll go all the way down to your calves. We're going to divide neck muscles into three main sections: anterior, lateral, and posterior sections. SCM is the muscle that you can see when you're facing someone directly. It originates on the sternum and clavicles and inserts into the mastoid process of your skull. That's why this muscle has three main functions. lateral flexion, neck rotation, and frontal head flexion. So in order to train it, you can do neck flexions, lateral flexions, and neck rotations. Then, on the side of your neck, we have 4 main muscles. Scalenes are the ones that have the main function of flexing your neck laterally. Besides them, we also have a levator scapulae, a muscle that starts on the neck and inserts into the scapula. That's why its main function is to elevate your shoulder blades, which is why doing shrugs is more suitable way to target this muscle. And finally, for the posterior side of the neck, we have 3 main capitis muscles. They connect your spine to your skull, and the best way to train them is through neck extensions. Besides them, it's also worth mentioning trapezius, which is also going to be involved in neck extensions, but we're going to cover it in more details when we discuss back muscles. So to summarize, in order to effectively train the entire neck musculature and develop a thick neck, there are 4 main movements that you should be doing: neck flexions, neck rotations, lateral flexions, and neck extensions. The main muscles of the back that we need to train are trapezius, rhomboids, latissimus dorsi, and teres major. Trapezius is a big muscle that inserts on the scapula and clavicle, but originates from the base of the skull all the way down to the lowest thoracic vertebrae. In the fitness world, when people refer to traps, they usually mean the upper portion of it. It's important that you understand that this is all just one muscle. However, it's possible to train one specific area of the muscle more than the other. Different sections of the muscle simply have different angles of the fibers, which is why it can move your shoulders in many different ways. So any exercise that involves scapular retraction, protraction, elevation, and depression is going to work your trapezius. Shrugs, pull-ups or pull-downs, any sort of rows, face pulls, and even rear delt flies, all of these are going to work your traps. Below the trapezius, you can find 2 rhomboid muscles. They originate on the spine and insert into the scapula. Their main function is to retract shoulder blades, which is why they will be involved in all of the exercises I mentioned for the traps, all except shrugs. They're not really that active when it comes to the scapula elevation. Latissimus dorsi is the widest muscle on the human body, spanning from thoracic vertebrae down to the sacrum, and all of these fibers meet up to insert into the humerus, or the upper arm bone. This muscle is able to pull your scapula in various directions, producing movements on the shoulder joints. The main movements are arm extension, internal rotation, adduction, scapular retraction, and shoulder depression. That's quite a few movements. I'd say the most important ones to keep in mind when training your lats are scapular retraction and depression. These will help you feel your lats the best way. So based on all of this, the exercises that will target your lats are pull-ups and pull-downs, all kinds of rows, and lat pullovers. Teres major is another important mover of the arm, mainly involved in internal shoulder rotation, shoulder adduction, and shoulder extension. That means that all of the basic pulling movements like pull-ups, rows, and pullovers are going to target this muscle. Teres major can be seen from the outside, and it gives that extra thick appearance of your back. Most of the muscles that move the shoulder joints are deltoid and rotator cuff muscles. Deltoid muscle can be divided into 3 parts based on its origins and the path of its fibers. Front deltoid originates at the lateral third of the clavicle. Side deltoid originates at the lateral margin from the acromion process of the scapula. Rear deltoid originates at the spine of the scapula. Each of these parts have its own unique set of fibers that are going towards the direction of insertion, which is the lateral aspect of the humerus or the upper arm bone. In order to target each part of the deltoid muscle, you need to follow the direction of these fibers. So the front delt draws the arm forwards to flex the shoulder, and it's involved in internal rotation of the arm. Rear delt draw the arm backwards in order to extend the shoulder. And finally, side delt is involved in shoulder abduction, which means it lifts the arm to the side. So, as you might have guessed, front delt raises will train your front delts, side lateral raises will train your side delts, and rear delt flies will train your rear delts. However, this is only if you want to isolate these muscles. Whenever you're doing any sort of pressing movement, your front delts will be engaged because the pressing movement is aligned with the part of the muscle fibers in the front delt. If you're pressing overhead, a little bit of the side delt will be engaged as well, due to the same reason. And whenever you're doing any sort of pulling movement, your rear delt will be engaged because your shoulder is moving towards the extended position. This means that the side delt is the only part of the deltoid muscle that is not being trained very well during these compound lifts, which is why it needs to be trained specifically with some sort of movement that will isolate this part of the delt. Some movement that involves shoulder abduction, something like side lateral raises or the upright rows. I also want to mention 4 rotator cuff muscles. They connect different parts of the scapula to the upper arm bone, which is why their main function is to rotate your arm. Rotator cuff injuries are very common, which is the main reason why I'm mentioning these muscles. Warming them up prior to your upper body lifting session is very important, which is exactly what you're going to do if you're following my warm-up routine. Pectoralis minor and pectoralis major are 2 main muscles of your chest. Pectoralis major is the bigger one that sits on the top of the pectoralis minor. And just like with the trapezius, pectoralis major can be divided into different parts due to its varying points of origin and different parts of the muscle fibers. To make this very simple, we're gonna divide it into 2 parts: the upper or the clavicular head and the lower sternocostal head. The upper part originates at the medial half of the clavicle, and the lower part originates at the sternum, ribs 1 to 7, and it's also tying into the external oblique muscle. All of these fibers meet to insert into the humerus, or the upper arm bone. So, the main functions are arm adduction and elevation, although it's also involved in shoulder depression. Based on the path of the muscle fibers, you can target specific areas of this muscle. For example, if you're doing shoulder adduction towards the ground, you will target more of the lower part of the chest, but the upper part is going to be barely involved in the movement. If you're doing horizontal adduction, then the entire chest muscle should be equally engaged. And if you're combining shoulder flexion and adduction, the movement of your arm will be more aligned with the muscle fibers of the upper chest, and therefore you will target more of the clavicular head. This is why when you're doing any incline press, you're gonna target more of the upper chest, and when you're doing a regular bench press, you're gonna target more of the lower chest. Keep in mind that when you're pressing on the bench, you will always have that arch in your lower back. So in order to have that horizontal adduction that will equally engage the entire pectoralis major, you will need to use the incline bench that is set at around 15 to 30 degrees angle. So 15 to 30 degrees of bench inclination versus 15 to 30 degrees of decline due to the arch of the lower back equals you pressing horizontally and engaging the entire chest muscle. Pectoralis minor originates at the end of the 3rd to 5th rib and inserts into the scapula. It's involved in scapular protraction and depression. If you want to target this muscle specifically, the ideal way would be to do this sort of reverse shrugs on the dip bar. And finally, we have serratus anterior. It's a weird looking muscle that originates on your ribs and inserts into your scapula. That's why its main actions are to protract your scapula and to rotate it upwards. So the best ways to target serratus anterior would be by using a roller or with the dumbbell pullovers, but it's gonna be pretty active when you're doing front raises. Well-developed serratus has a really cool appearance and it gives more detail to your abdominal area. Main upper arm muscles that we want to train are biceps, triceps, brachialis, and brachioradialis. When we look at the biceps origin, we can see that it crosses the shoulder joint. When we look at its insertion, we can see that it crosses the elbow joint to insert into the radius bone. This means that the biceps is involved in 3 movements: elbow flexion, forearm supination, and it also assists in shoulder flexion. That's why you get a better biceps contraction when your arm is in a flexed position. You can try it out, see for yourself how you can feel a better contraction here than when your arm is in a more extended position. So we can use this knowledge when we train our biceps and try to supinate our forearms and flex our shoulders as we curl. Or we can position our arms behind the torso to get it in a more stretched position if we're trying to make it biased more towards the lengthened position. Below your biceps sits another important muscle called brachialis. It originates into the distal half of the humerus and inserts into the ulna. Because of its insertion point, your brachialis contracts whenever there is an elbow flexion, regardless of the hand position. Brachioradialis originates at the end of the humerus and inserts into the end of the radius. So listen, all of these muscles will assist each other during the exercise that involves elbow flexion. However, different hand positions will determine how much they contribute to the lift. When we're using a pronated grip, both our biceps and brachioradialis are positioned in disadvantage. So now the brachialis is going to be the main contributor to the lift because it's the only muscle that is not affected by the hand position. That's because it's the only one of these muscles that inserts into the ulna. You can test this by yourself. So when you rotate your forearm, you can see that ulna always stays in the same position while the radius is circling around it. Okay, so when we put our hand in the neutral position and perform curls like that, now brachioradialis is positioned parallel to its origin, so it can contribute much more to the elbow flexion compared to the other 2 muscles. Finally, when the forearm is supinated, now the biceps has the biggest advantage because one of the biceps functions is to supinate the forearm, plus the pull is directly aligned with the biceps insertion point. Also keep in mind that whenever you perform the elbow flexion while training your back with the pulling movements, all of these muscles are going to be engaged to a certain degree, depending on how much elbow flexion there is in the movement and by the position of your hands. Triceps has 3 heads and it's twice the size of the biceps muscle. The long head of the triceps is the one that crosses your shoulder joint and originates at the scapula. The lateral head originates from the posterior side at the top of the humerus. The medial head lies beneath these 2 and originates also at the top of the humerus right next to the lateral head origin. The muscle fibers of all 3 heads meet and converge into a tendon that attaches at the end of the ulna. The main function of your triceps is the elbow extension. However, since the long head does cross your shoulder joint, triceps is involved in shoulder extension and shoulder adduction. This means that your triceps is going to be engaged in any exercise that involves elbow extension, which is every single pressing exercise. When we specifically focus on training our triceps through the isolation exercises, we can make sure the exercise is more biased towards the lengthened position by flexing our shoulders. This is why you can get a full tricep stretch when performing skull crushers or overhead triceps extensions. On the other hand, if you want to focus more on the contraction, we can do the press downs or the kickbacks because our shoulder is now in the extended position. This is why I suggest that you always add a little bit of the shoulder movement when training your triceps. Moving on to the forearms. There's a bunch of muscles there, so we're gonna simplify it as much as possible. We've already mentioned brachioradialis. This muscle takes a huge portion of your forearm. So just by performing any movement that involves elbow flexion while your hand is in the neutral position, that's gonna add a lot of size to the anterior part of your forearm. Okay, so we can divide forearm muscles into the anterior part on the front and the posterior part on the back. The anterior forearm has all the flexors. These are involved in curling your wrist and keeping your grip tight. Posterior forearm has all the extensors. These are involved in wrist and finger extension. So any movement that requires you to have a strong grip, which is every single pulling exercise, all of these are going to work your forearms isometrically. For the majority of the people, this is going to be enough to develop decent forearms. But if you have a bit more stubborn forearm genetics, or you simply want to add more size to your forearms, then you can add wrist extensions and wrist flexions to your training routine. This is what's going to maximize your forearm development. In muscle anatomy, there is no definite list of core muscles, which is why it can get a bit confusing whenever someone is referring to core strength or core muscle training. Core muscles are generally the muscles that contribute to spine stability, increase the pressure within the abdomen, and support the limb movement. Sounds like they're important, and they are. There's about 29 pairs of muscles that stabilize the spine, hip, and pelvis that could be considered as the core muscles. For the purpose of this video, which is building the aesthetic physique based on the understanding of the muscle anatomy, we're gonna split these core muscles into two groups: the abdominal muscles and the back muscles. These are going to be the most important muscle groups that move the spine. I'm not gonna cover all of the muscles that function as the stabilizer, because that's not the purpose of this video. Regarding the abdominal muscles, we're going to divide them into two groups: the anterior and the posterior abdominal wall. Let's start with the rectus abdominis, or something that you may know as a six-pack. It originates at the sternum and ribs 5 to 7, and it inserts into the pubis. This muscle has the inner line called linea alba that separates the left and the right side, and it also has this tendinous intersection between the muscle bellies. The main action is the flexion of the trunk. Now, depending on which part of the body is in a fixed position, that will determine how this movement is specifically going to present itself. For example, when you're doing crunches, your lower body is in the fixed position, so you're performing the flexion by moving your upper body. On the other hand, let's say you're doing some hanging leg raises. In this case, your upper body stays in the fixed position and your lower body is moving in order to create that flexion. On the side of the external abdominal wall, we have the external obliques that originate from the ribs 5 to 12 and insert into the iliac crest, pubic crest, and the pubic tubercle. It also inserts into the linea alba, which means that its muscle fibers meet into this flat tendon that we call the rectus sheath that crosses over and holds the rectus abdominis. Both sides of obliques will engage to flex the trunk forward alongside with the rectus abdominis. However, if you want to laterally flex your trunk, then only one side of the obliques will be engaged. And since the fibers of the external obliques pass downwards towards the midline direction, when you perform any sort of twisting movement or when you're making that side bend, the movement will be aligned with the part of these muscle fibers and you will maximize their engagement. This means that if you wanted to maximize their development, you would have to include this type of movement in your training program. There's also two more layers beneath the external obliques. We have internal obliques and transversus abdominis, both of which are involved in flexing and twisting your trunk, only they don't look as cool as the external obliques. With the posterior abdominal wall, we have three main muscles that I'd like to mention. Psoas minor, psoas major, and iliacus are the main movers when it comes to lifting your thighs towards the torso. These muscles start from the lower back and pelvis, and they attach into the thigh bone. They are the most important hip flexors because of their attachments and the biomechanical advantage. So when you're training your abs with the hanging leg raises, These muscles are the reason why you're feeling it in your lower back. They're going to be involved in the first part of the movement since they have the biggest biomechanical advantage. During the second part of the movement, your abdominal muscles are going to take over because they are involved in tilting the pelvis and bending the spine. They're not attached to your legs. Let's start with my favorite muscle, probably your favorite as well. Glutes. We have gluteus maximus, gluteus medius and gluteus minimus. They all originate at the back side of the ilium and insert into the femur, except that the gluteus maximus shares another tendon with tensor fascia latae and inserts all the way down into the top of the femur. The main function of the gluteus maximus is to extend the hip, although it's also involved in the hip external rotation and hip abduction. Gluteus medius and gluteus minimus are mainly involved in hip abduction and internal rotation. That's why if you wanted to maximize glute development, I would make sure that you have some squats, lunges or hip thrust movements to work that glute through the hip extension, but also some hip abduction to get that full round appearance of the entire gluteal musculature and not neglect gluteus medius and minimus. Now we can move on to the thigh muscles, and we can split it into three groups: quadriceps, hamstrings, and adductors. But before we do that, I have to mention the sartorius, which is the longest muscle in the human body. It originates at the front of the pelvis and inserts into the top of the tibia. It's involved in hip flexion, external rotation, and abduction. So basically, if you're doing leg raises or hip abductions, you will ensure that this muscle is sufficiently developed. Okay, let's talk about the quadriceps. There are 4 quadriceps muscles and they all insert into the common patellar tendon. 3 of them originate at the femur. Those are vastus lateralis, vastus intermedius, and vastus medialis. On top of the vastus intermedius is the rectus femoris, and it's the only one that crosses the hip joint. So all of them function as the knee extensors, but because rectus femoris crosses the hip joint, it's also involved in the hip flexion. This is why when you lean backwards on the leg extension machine, you will feel your rectus femoris stretching out, and this was actually shown to enhance its growth when you're training it that way. Anyways, all 4 quadriceps muscles work as the knee extensors, so any exercise that involves knee extension is going to target your quads. On the back side of the thigh we have 3 hamstring muscles: semitendinosus, semimembranosus, and biceps femoris. They all cross both knee and hip joints, which means that they are involved both in knee flexion and hip extension. Now keep in mind that biceps femoris has 2 heads, and one of them does not cross the hip joint, but it attaches into the femur. This means that in order to train this head, you will need to do some sort of knee flexion movement, like leg curls, for example. So in order to maximize your hamstring development, you will need to include both knee flexion and hip extensions. For the hip extensions, best exercises are going to be Romanian deadlifts or good mornings. And for knee flexions, you can do any type of leg curls or glute ham raises. Then we have the adductors. They are composed out of 5 muscles that are positioned between your thighs. They all originate at the pelvis and insert into the femur, all except the gracialis. This one inserts into the tibia, which is why it contributes to the knee flexion as well. So as you may have guessed, the main function of the adductor muscles is to perform hip adduction. They're gonna be involved in most of the squatting exercises, especially if you're using a wider stance, but the best way to ensure their maximum development is to do some hip adductions on the machine as well. Now we're moving on to the lower leg muscles. We're gonna divide them into anterior and posterior sections. On the anterior side of the lower leg, we have the muscles used for dorsiflexion. The biggest one is tibialis anterior. Anyways, we're not gonna cover all of these muscles. What's important for you to know is that all of them cross the front ankle, which means that they all contribute to dorsiflexion. We can train these muscles by using the machine, resistance bands, or by doing something that I call back-to-wall tibialis raises. And finally, calves. We have two calf muscles, gastrocnemius and soleus. Their muscle fibers meet together to form the thickest tendon in the human body and insert into the heel.
Gastrocnemius is the one that crosses the knee joint, which is why you can often feel it working when you're doing leg curls.
Anyways, their main function is plantar flexion. When you're doing standing calf raises, both of these muscles are going to be engaged. But when you're doing seated calf raises, that is going to isolate the soleus. So to get the maximum calf development, you will have to include both of these exercises into your training plan.